안녕하세요. 허인식 원장입니다.
Hello, I'm Dr. Ho In-shik. Today, I'm going to talk about various aesthetic materials used in digital dentistry. There are various materials used for digital dentistry, but for aesthetic purposes, there are three representative materials used. First, hybrid resin ceramic. The second, glass ceramic. The third one is zirconia. First, let's look at hybrid resin ceramic. The hybrid resin ceramic has the aesthetic aspect of the glass ceramic, plus plasticity and ease of manipulation of resin material. So it can have a very good result if it is used only for inlay, onlay, laminate veneer, or single crown. Relatively, compared to porcelain, it has low chipping and it is very easy to manipulate. That's why it is used widely. And it doesn't involve sintering, so the time required for it is shortened. The average strength is about 120 to 200 megapascal. For hybrid resin ceramic, to mill the material, there are three types of milling machines that can be used. First, 4-axis milling machine. A one-size burr is used for the milling with water. The second, 4-axis milling machine. It is milled with water, and there are about 3 types of burrs used. This is for more precise milling. The third one is used to mill hybrid resin ceramic in a disc form, and the machine does not use water, so it is a dry type milling machine. The first milling machine, like this, a block of hybrid resin ceramic is mounted onto the machine. A very thick burr is mounted. Water is supplied, while inlay, onlay, or a crown is milled. However, with a thick burr, something is milled, so inevitably, over-reduction can occur. So like this, there should be some gaps between restoration and the prepared tooth, which can be visible. So this looks like a coarse job of treatment. So it may look like the fitting is not very good, and it may require a lot of occlusal adjustment. The second milling machine, the same milling block is used with water while milling, and the 3 different sizes of burrs are used. Compared to one-size burr system, this is more precise in terms of the output. However, if you use a block like this for milling, the connector is attached to the contact surface. When there is a proximal caries, occlusal adjustment or contact adjustment would require a lot of time, and that is a disadvantage of this. So the restoration with a contact surface, when it is milled, it may require a lot of time for setting, adjusting the contact with the adjacent area, or when removing the bonding agent. And there is always a chance that the fitting may not be very good. The third type of milling, round disc is used to mill a hybrid ceramic. So like this, a round disc is milled. The hybrid ceramic is in the form of a round disc. The round disc can be milled very precisely because 3 different sizes of burrs are used for the milling. However, if a connector is attached on the occlusal surface after setting, a lot of adjustment is required for the anatomical form on the occlusal surface, so it is very difficult to reproduce the design. So today, milling with a connector is not used any longer. Now, milling with gypsum investment in the disc is widely used. Using the method, the anatomical form on the occlusal form can be preserved as designed. That's the merit, and the contact points can be preserved. So the setting time would be saved quite considerably. That is the advantage. Best indication for inlay using hybrid resin ceramic. The best indications would be non-proximal case like BO cavity or O cavity or LO cavity. If contact points are in many different areas, like in this very complicated cavity, I would recommend the crown rather than hybrid resin ceramic because it is very difficult to prepare a tooth and it is very difficult to bond the prepared tooth and to remove residual resin cement. And also, the material's longevity is not very long, so in the follow-up, the restoration would be found to be fractured in many cases, so a crown is recommended rather than hybrid resin ceramic. Hybrid resin ceramic, in the last step of milling, sintering is not involved. If coloring is what you want to do after polishing, stain liquid is used for the coloring, and it is light cured to provide color to the restoration. The second aesthetic material is glass ceramic. The glass ceramic is in the block form and it is mounted on the 4-axis milling machine to be milled with water. The representative ceramic material is Emax and Empress. Emax has the strength of 530 megapascal and Empress has the strength of 185 megapascal. So if you want some strong material, Emax is recommended rather than Empress. If you look at the workflow for Emax, after milling, polishing is done, and crystallization using heat is the next step before finishing. If Emax crown needs to have some color, glazing and staining need to be added. And crystallization, that step should be added. For Empress, normally crystallization, the heat treatment is not required. Polishing is good enough, but if special color is what you want to add, glazing and heat treatment need to be added for staining. I believe the best indication for ceramic prosthesis using 4-axis machine is the anterior laminate. because it is difficult to make a temporary crown after preparing a tooth for laminate. So my recommendation is that in the dental office, the milling should be done immediately and bonding needs to be provided on the day. So laminate can be the best ceramic indication. Lastly, the aesthetic material would be zirconia. Zirconia prosthesis, you can see something like this, white and opaque, lacking translucency. They are not in harmony with adjacent teeth in terms of color. You may think of this situation when you think of zirconia, but that is no longer so. Because of advancement of physical property of zirconia, as it has gone through multiple generations, zirconia with a translucency and various colors, even multicolored zirconia is launched. Like this, multi-layered zirconia is on the market. Different colors from cervical to body to incisal edge. So zirconia, various zirconia is available from different companies. It doesn't require separate coloring, so a zirconia crown is very similar to natural teeth. The biggest advantage of zirconia is it is easy to manipulate. Upper life cycle can be extended as soft property of zirconia. It is milled like a piece of wood before sintering. Like this, after milling the zirconia crown, heat treatment is provided before final prosthesis would be produced with 20% of contraction. On the side of zirconia disc, you can see the contraction rate of the zirconia disc. For each zirconia disc from different companies, they have different contraction rates, and you need to consider the contraction rate when you mill the disc to get accurate prosthesis using the zirconia crown. If you want to give a character in terms of color, glazing and staining need to be conducted to add color. Through the process, you get zirconia crown. As you can see, this is the first molar in mandible. A zirconia crown is given there. It looks very natural and highly aesthetic, and the prosthesis is very strong. Not only in the posterior region. If you look at here, number 21 tooth was extracted and a bridge is provided in the anterior region. The anterior bridge is made with the full zirconia. It is very aesthetic. The posterior bridge had to be replaced because of some cement wash. For the premolar and the most distal tooth, natural tooth crowns were provided with implant prosthesis in the middle for the first molar. Please look at the color of the final prosthesis. They are not opaque as we used to see in the conventional zirconia. The color is natural and aesthetic. As you can see, the anterior implant prosthesis is very aesthetic and translucent. So in that respect, zirconia crown doesn't have any restrictions in terms of indications. Let me summarize what I have discussed today. Digital dentistry utilizes three aesthetic materials, as I said before. Hybrid resin-ceramic is the first one. The second one is glass ceramic, and the third one is zirconia. Hybrid resin-ceramic is used for inlay and onlay. Glass ceramic is used for anterior region laminate, premolar, and single crowns. Zirconia crown can be used from anterior to natural tooth and implants without any restrictions in the indications. If you use an intraoral scanner and utilizes the information from the scanner, and depending on how you fabricate the prosthesis, the preference for materials can be changed. If you design yourself and fabricate the prosthesis yourself, or if you want to outsource the lab work, your preference for materials can be different because if you fabricate the ceramic, hybrid resin, ceramic, and zirconia all in your clinic, you need to be equipped with 4-axis and 5-axis milling machines and all other materials. Recently, as the zirconia discs aesthetic effect is improved quite a lot, you don't need to use conventional ceramic crowns. So in a small clinic, you just need to have 5-axis milling machine, and that would be much more reasonable and economical to use the disc-based 5-axis machine. However, if you use an external lab for a prosthetic work, you don't need to have 4-axis or 5-axis milling machines, so you can utilize the devices in the lab. You can use various materials, including ceramics, hybrid resin, ceramic, or zirconia crowns. Recently, thanks to the rapid advancement of digital dentistry, materials have been developed with a tremendous physical property advancement and aesthetic effect. I would like to invite you to experience such satisfactory prosthesis like me using various materials through digital process. Thank you for your attention.